जानी कंपेटिटर स्क्रिप्ट का स्ट्रॉन्ग पेन पॉइंट स्ट्रक्चर लेकर मैंने इसको डॉक्टर एलन प्राइम स्टाइल में रीराइट कर दिया। मैं हीरो अब 1 टीस्पून इसबगोल स्लैश सिलियम हस्क है, QR स्लैश प्रोमो रिमूव्ड, सेफ्टी वार्निंग्स एडेड। Good morning, good afternoon, good evening, wherever you are in the world. I want you to stop for a moment, because what I am about to share may change the way you understand hard stool, bloating, and that uncomfortable feeling that you need to go, but nothing wants to come out. If you are over 60 and your bathroom routine has become frustrating, if you sit on the toilet and feel pressure in the rectum, if the stool feels hard, dry, stuck, or incomplete, if your belly feels bloated and heavy even after eating carefully, please understand this. You are not alone, and you are not imagining it. This problem is extremely common after 60, but most people are never taught what is actually happening inside the body. Many people think constipation only means the stool is moving slowly through the colon. And yes, that can happen. But there is another problem that feels very different. The stool has already moved down. It is already near the exit. You feel the urge. You know something is there. You sit down, you wait, you push, and still it feels stuck. Maybe a small hard piece comes out, but the rest stays behind. Maybe you feel unfinished. Maybe you stand up from the bathroom feeling even more uncomfortable than before. That feeling can make your whole day miserable. You feel bloated. Your stomach feels tight. You may lose your appetite. You may become afraid to eat because you know it might make the pressure worse. Some people start planning their morning around the bathroom. Some people sit too long, strain too hard, and then end up with hemorrhoids, burning, soreness, or even small tears. And the most frustrating part is that many common remedies do not seem to work the way you hoped. I am Dr. Alan Prime, and today I want to explain this in a way that is simple, honest, and useful. I want to show you why hard stool and bloating become so common after 60, why pushing often makes things worse, and how 1 simple teaspoon may help support softer stool, easier bowel movements, and a more comfortable morning bathroom routine. And I want you to stay with me, because this is not about taking harsh laxatives every day. This is not about forcing the body. This is about understanding the body, giving the stool what it needs to stay soft, giving the rectum the right position to release, and using a simple food-based support that many people already know by the name Isabgol, or Psyllium Husk. Now let us begin with the problem. Why does stool become hard after 60? As we get older, digestion often slows down. The muscles of the intestine may not move as strongly as before. Many adults drink less water because they do not feel as thirsty, or because they do not want to urinate so often. Some eat less fiber than they realize. Some take medications that slow the bowel, such as certain pain medicines, iron supplements, calcium supplements, some blood pressure medicines, and other prescriptions. Some people ignore the urge to go because they are busy, outside the home, traveling, or embarrassed. And when stool stays inside too long, the body keeps pulling water out of it. That is one of the most important things to understand. Stool does not become hard by accident. It becomes hard when it loses water. The longer it sits, the drier it becomes. The drier it becomes, the harder it is to pass. And the harder it is to pass, the more you strain. The more you strain, the more the muscles around the rectum can tighten instead of relaxing. That is the cycle many seniors get trapped in. Think of stool like a soft sponge. When it has enough water, it bends, moves, and passes more easily. But when that sponge dries out, it becomes stiff, rough, and difficult to move through a narrow space. That is what hard stool feels like in the rectum. It is not only about needing more force, it is about needing more softness, more water, and better movement. This is where many people make their first mistake. They try to push harder. But pushing harder is not always the answer. In fact, pushing too hard may make the problem worse. When you hold your breath and bear down, the pelvic floor muscles may tighten. The rectum may not open the way it should. The pressure increases, but the exit does not relax. That can lead to hemorrhoids, pain, swelling, and that terrible feeling that the stool is right there, but still will not come out. So the first lesson is this. The goal is not to fight your body. The goal is to soften the stool, hydrate the stool, relax the exit, and help the body release without panic. Now let us talk about the 1 teaspoon that may help. 1 teaspoon of Psyllium Husk, also known as Isabgol, mixed into a full glass of water. This simple ingredient has been used for generations, and when used correctly, it can be very helpful for hard stool, irregular bowel movements, and that dry, stuck feeling many adults experience after 60. Psyllium is a type of soluble fiber. That means it absorbs water and forms a soft gel. And that gel can help hold water in the stool, making it softer, smoother, and easier for the body to move. This is very different from harsh stimulant laxatives. Stimulant laxatives force the bowel to contract. Sometimes they work quickly, but they can also cause cramping, urgency, discomfort, and if used too often, dependence. Psyllium works differently. It does not whip the bowel. It does not irritate the intestine. It helps create a better stool texture. It adds gentle bulk and moisture so the bowel has something easier to move. But there is one rule you must never ignore. Psyllium must be taken with enough water. Do not take it dry. Do not put dry psyllium in your mouth and swallow it. Do not take it with just a tiny sip. That can be unsafe because psyllium expands when it touches liquid. It needs enough water so it can form that soft gel properly. The safer way is simple. Take 1 teaspoon, mix it into a full glass of water, stir it well, and drink it soon after mixing. Then follow with a little more water if needed. For many people, this may help support a softer bowel movement. Some feel improvement the same day. Some need a few days of consistency. Everyone is different, and I do not want you to think this is magic or a guaranteed instant cure. But for many adults over 60 who deal with hard stool and bloating, this 1 teaspoon can be a powerful place to begin. Now here is where many people go wrong. They hear that fiber helps constipation, so they take too much too quickly. That is a mistake. If your body is not used to fiber and you suddenly take large amounts, you may feel more bloated, more gassy, and more uncomfortable. Your gut needs time to adjust. That is why I like the small start. 1 teaspoon in a full glass of water. Not 3 tablespoons, not a giant scoop. Start gently. Let the body respond. And if you are sensitive, you may even start with half a teaspoon for a few days before moving up. And please remember, psyllium can affect how some medications are absorbed, so do not take it at the exact same time as your prescription medicines. Many people separate it from medications by at least 2 hours, but you should ask your doctor or pharmacist what timing is best for you, especially if you take thyroid medicine, heart medicine, diabetes medicine, blood thinners, or multiple prescriptions. Also, if you have difficulty swallowing, a narrowing in the esophagus or intestines, bowel obstruction, severe abdominal pain, unexplained vomiting, or a history of bowel blockage, do not use psyllium without medical guidance. If you have kidney disease, serious digestive disease, or have been told to restrict fluids, talk with your doctor before adding fiber like this. Natural does not mean unlimited. Safe means using the right thing in the right way for your body. Now let us talk about bloating, because many people over 60 say, Dr. Alan Prime, I am not only constipated, my belly feels swollen, I feel full, I feel heavy, I feel like gas is trapped. Bloating often happens when stool is moving too slowly or when the gut is adjusting to fiber. If stool sits too long, gas can build behind it. The belly may feel tight. You may burp more. You may pass gas more. You may feel pressure after small meals. And sometimes, the more you worry about it, the more tense the belly becomes. Psyllium may help some people with bloating over time by supporting more regular stool movement, but it must be introduced slowly. Too much too fast can increase bloating at first. This is why water, patience, and gradual use matter so much. You are not trying to shock the body. You are trying to teach the body a better rhythm. The second part of this solution has nothing to do with what you eat. It has to do with how you sit. Most modern toilets put your body in a position that is not ideal for releasing stool. When your feet are flat on the floor and your knees are low, the angle of the rectum may stay partially bent. Think of a garden hose with a kink in it. You can push water through it, but it takes more pressure. The same idea can happen during a bowel movement. The stool may be ready, but the angle is not helping you. The simple fix is to place a small stool under your feet when you sit on the toilet. Raise your knees above your hips. Lean forward slightly. Rest your elbows on your thighs. Let your belly relax outward. Do not suck it in. Do not clench. Do not hold your breath. Then breathe slowly. Take a slow breath in through the nose. Let the belly expand. Then breathe out gently through the mouth. As you exhale, imagine the pelvic floor softening and opening. You are not forcing. You are releasing. That one change can make a tremendous difference for people who feel stool stuck near the exit. This is important because the body is not a machine you can bully. The rectum, the pelvic floor, the belly, the breath, they all work together. If you are scared, tense, rushed, or pushing too hard, the muscles may resist. But when your knees are higher, your belly is soft, and your breathing slows down, the body often gets a clearer signal that it is safe to let go. Now let us talk about what to do so this problem does not keep coming back. Because the goal is not to wait until you are miserable and then rescue yourself. The goal is to build a routine that keeps stool soft before it becomes a hard plug. There are 3 simple foods that can support this beautifully when used wisely. The first is kiwi. Kiwi is one of the most underrated fruits for digestion. It contains fiber, water, and natural compounds that may help support bowel regularity. Many people find kiwi gentler than some fiber supplements. For seniors, 2 kiwis in the evening or with dinner may help support softer stool and easier bowel movement over time. You can eat the inside with a spoon, or if you tolerate the skin gives extra fiber. But there is no need to force it. The important thing is consistency. The second is ground flaxseed. Ground flaxseed is very different from whole flaxseed. Whole flaxseed often passes through the body without doing much. Ground flaxseed can absorb water and form a soft, gel-like texture. That can help support stool softness. 1 tablespoon mixed into oatmeal, yogurt, a smoothie, or water can be a gentle daily support. Again, water matters. Fiber without water can make stool harder. Fiber with water can help make stool softer. The third is prunes. Prunes have been used for constipation for a long time because they contain fiber and a natural sugar alcohol called sorbitol, which may help draw water into the stool. For many people, a few prunes in the evening can help support a more comfortable morning. But do not overdo it. Too many prunes can cause gas, cramping, or loose stool. Start small. 4 or 5 prunes may be enough for some people. Now I want to correct a mistake that causes a lot of suffering. Do not add fiber without adding water. This is one of the biggest reasons people say, fiber made me worse. Fiber is supposed to hold water and soften the stool. But if you take more fiber and do not drink enough fluid, that fiber can become thick, dry, and heavy. It may increase bloating. It may make stool feel even more stuck. So when you add psyllium, flaxseed, kiwi, prunes, or more vegetables, water must come with it. For many adults, sipping water throughout the day works better than drinking a large amount all at once. Warm fluids in the morning may also help some people. A warm cup of water, herbal tea, or warm lemon water can help wake up the gut gently. But again, do not force water if your doctor has told you to limit fluids because of heart or kidney problems. Always match the advice to your condition. Another mistake is ignoring the urge. When the body tells you it is time to go, go as soon as you reasonably can. The rectum has stretch sensors. When stool arrives, it sends a message to the brain. But if you ignore that message again and again, the rectum can become less sensitive. The stool sits there longer. More water gets pulled out. It becomes harder. Then later, when you finally have time, the urge is weaker, the stool is drier, and the bathroom becomes a struggle. This is especially common in older adults who do not like using public bathrooms, people who travel, people who are caregivers, or people who are embarrassed. But your body is giving you a signal for a reason. Respect that signal. Another mistake is sitting too long on the toilet. Many people sit for 20 or 30 minutes, scrolling on their phone, pushing again and again. That can increase pressure on the rectum and worsen hemorrhoids. A better approach is to give yourself a calm window. Use the right posture, breathe, and if nothing happens after a reasonable time, get up and try again later. Do not turn the toilet into a battle. Now, there are times when you should not manage this alone. Most constipation is not dangerous, but certain warning signs deserve medical attention. If you see blood in the stool, especially dark blood or blood mixed into the stool, talk with a doctor. If you have black stool, unexplained weight loss, severe abdominal pain, vomiting, fever, or you cannot pass gas, get medical help quickly. If constipation begins suddenly after age 45 or 50 and you do not know why, do not ignore it. If your stool becomes pencil thin and stays that way, ask your doctor. If you repeatedly feel stool stuck and cannot pass it, that may be fecal impaction and may require medical care. And please, if you have severe pain in the rectum, ongoing bleeding, or symptoms that keep returning despite changes, do not feel embarrassed. Doctors hear these problems every day. Your health is more important than embarrassment. Now let us bring this together in a simple way. If you are over 60 and dealing with hard stool, bloating, and that stuck feeling, begin with the basics. 1 teaspoon of Psyllium Husk, Isabgol, mixed into a full glass of water may help support softer stool and easier bowel movement. Start small. Use enough water. Do not take it dry. Separate it from medications. And ask your doctor if you have kidney disease, swallowing problems, bowel disease, fluid restrictions, or take important prescriptions. Then change your bathroom position. Feet on a small stool, knees above hips. Lean forward, belly soft. Slow breathing. No harsh pushing. No panic. Then support regularity with simple foods. Kiwi, ground flaxseed, prunes. Enough fluid. Fiber added slowly. And when the urge comes, listen to it. I know this topic can feel uncomfortable to talk about, but there is no shame in wanting your body to work properly. There is no shame in wanting relief from hard stool. There is no shame in wanting a morning bathroom routine that feels easier, calmer, and less stressful. Your digestion is part of your health. Your comfort matters. Your daily routine matters. Many people suffer quietly for years because they think constipation is just part of aging. But hard stool, bloating, and straining should not become your normal life. The body may need more water, more soluble fiber, better timing, better posture, and a little more patience. When you give it those things, it often responds better than you expect. So tonight, think about what your body has been asking for. Maybe it has been asking for more water. Maybe it has been asking for softer fiber. Maybe it has been asking you not to ignore the urge. Maybe it has been asking you to stop pushing and start releasing. Small changes repeated daily can make a big difference. This is Dr. Alan Prime reminding you to listen to your body, support your digestion gently, and never be embarrassed to take care of a problem that affects your comfort, your energy, and your quality of life. One kinder choice today may help tomorrow morning feel easier. Your body is still listening. Give it the support it needs, and let your next chapter feel lighter, calmer, and more comfortable.